I'm not seeing any particular questions coming in on the chat right now. Maybe I will ask you one. If a woman notes a change in the nipple, such as redness or scaling, or maybe even sort of the skin of the nipple feels irritated, what should she do about that?
So that's definitely something that you should seek attention for from a breast specialist right away. So it is possible for the nipple to get dermatitis just like any other part of the body, but we worry about rash or scaliness of the nipple because sometimes that can be caused by underlying malignancy, often a pre-invasive breast cancer called ductal carcinoma in situ. And so we do take that very seriously and would want to evaluate it immediately.
And what about if a woman does feel a lump under their arm?
So if you feel a lump under your arm, that should also definitely be checked out, because sometimes there can be breast cancer that we can't see or feel in the breast. And the first place that breast cancer often travels is to the lymph nodes under the arm. So although usually lumps under the arm can also be associated just with inflammation, or if you were recently ill, it's always a good idea to get those checked out just to make sure that it's not a new manifestation of something a little bit more scary.
So tenderness near the armpit is not usually worrisome, but again, if you feel a lump associated with that tenderness under the armpit, then you would want to come in for that. And so finally, anything different to look for if you're pregnant? There's a lot of changes in the breast during pregnancy, but do you look for anything different in that setting?
So lots of changes happening in the breast during pregnancy, and you can definitely feel new lumps, lots of breast tenderness and pain. The breasts often swell and engorge during pregnancy, and those can all be normal. But if something is feeling different, I like to look at the other side and then see, is the change the same on both sides? So if you are really seeing something that seems like it's only happening in one breast, and especially if it's kind of focal to one area versus all over the breast, I think that is always a good idea to get that checked out.